Welcome back. God is great, and thank you for another day for joining me and my family towards my journey to full recovery as we fight against stroke and cardiovascular diseases. I would like to start off with some alarming studies and data on cardiovascular diseases. This was an article that I was reading from the American Heart Association. Facts: at least 6 in 10 adults could be affected by cardiovascular disease within the next 30 years, according to a new science report. The projected rise in heart disease and stroke, along with several key risk factors, including high blood pressure and obesity, is likely to triple in related costs to $1.83 million by 2050. And by 2050, obesity is expected to affect a third of children, up from 20% in 2020. The highest increase expected among children 2 to 5 years old and 12 to 19. Contributing factors such as insufficient physical activity and a poor diet are to remain as high as 60% of all children over the next 3 decades. According to the American Heart Association, we can bend the cost curve on cardiovascular disease, but this will require strategic investments in cardiovascular prevention and treatment. It will take all of us working together to make this happen. It is my hope, and with the help of my God, Lord and Savior Jesus Christ, to be a part of that mission. Today, I'm going to continue to talk about some specific exercises that I do to help me to continue with my improvements on the following things. The use of my right hand. Still having much difficulty with it. Still can't hold some certain things like tools. My back to normal or better improvements in mobility and overall my good health and well-being. So that's what I'm working on. To begin with, I'm done with occupational home therapy. Hopefully, I'll be going to outpatient physical and occupational therapy. That wait begins. Just wait for approval from the VA hospital. Every day, I feel little gains and improvements in my energy, strength, endurance, coordination, stability, and overall health. I'm trying to eat more protein. I've added boiled eggs to my diet while maintaining a low glycemic load, low cholesterol diet, so everything I eat must be with the thought of portion control and moderation. Moderation is the key. I want to talk about a power food called eggs. Hard-boiled eggs for me right now. Eggs offer the following benefits. High quality protein. Eggs contain all non-essential amino acids, making them a complete source of protein. High quality protein, I already said that. Rich in vitamins and minerals. They are a good source of vitamin D, B12, selenium, phosphorus, and choline. Choline is essential for brain function, muscle control, and metabolism. Very important for recovering stroke victims like me. Heart health. Some studies suggest that eggs may improve HDL, the good cholesterol levels, potentially lowering the risk of heart diseases. Eye health. Eggs are rich in lutein. I can say that word. And this one's a hard one. Zeaxanthin. zeaxanthin. Don't know if I said it right, but I looked it up. It was an antioxidant that can help protect against age-related eye disease like macular degeneration. Weight management. The protein in eggs can help you feel full, and it sure does. It does help with that appetite control, potentially reducing cravings and aiding in weight loss. I started the boiled egg diet about 2 days ago, just adding some eggs with my salad. It's helpful with the added protein. Brain health. Cold in the eggs is important for brain development and function. Immune systems. Vitamin A, B12, and selenium in eggs support a healthy immune system. Skin health. Some vitamins and minerals in eggs help maintain a healthy skin and hair. Supposed to help with preventing hair loss, alopecia. Muscle health. The protein in eggs help maintain and repair muscle tissue. This week I've gained 2 pounds, up to 150 pounds now, so that's a good news. I've also improved on the stationary bike. I was doing 30 minutes now. Now I'm doing up to 40 minutes. I felt good yesterday. I was energized, so I said, why not go for another 10 minutes? But at a very slow pace. Low intensity, but I still need assistance of getting on and off the bike. The height of the bike is still too hard to lift my leg over it. So that needs work on. I'm going to continue to talk and demonstrate a few more hand exercises, but the majority of the exercises will focus on progression of my lower leg exercises, with mainly focus on my right legs and feet. When I get up and throughout the day, throughout the day, I like to do some stretching first. So with the hands. First, maybe I like to stretch the wrists. I do this whole stretch with the wrists and fingers for a count of maybe up to 100, depends on you, but it feels better. The longer you stretch it, the better it feels. It helps with that range of motion too. But here's what it looks like. It helps relieve that tightness. Alright, here we go. Okay, so basically the wrist, again the supination, pronation, but I have a hard time getting to a 90-degree angle. That's tough on the right side. So what I do is I put it up as high as I can go, and I hold the stretch and count up to 100, very slow, just a slow count, and it feels good, relieves that tightness, and improves that range of motion again. So I just 1, 2, 3, 4, 5. I could be laying in bed, sitting in a chair. I just do this throughout the day, as it helps with that range of motion, that tightness. That tightness just is there. So that's one exercise that I do. Wrist rotation, stretch, hold count, repetition. So I have a hard time with rotating my wrists, especially my right wrist again. So I can rotate it like this, and that's about it. I can rotate it back fully, but when I rotate it to a pronated position, it's tough. See, notice my elbow working. My elbow is supposed to be right here, stable, and it's about right here. I can do that. So what I do is I take it again, assist it, hold, and count to 100. Sometimes I just go to 10, and I do repetition movement just to help with that range of motion. And I just hold it, count 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And I repeat again. And I just do it as much as I could. Sometimes up to 50, depending on how I feel. Sometimes up to 100. I count to 10. And that's another one. Finger to finger. I call this finger to finger push and holds. Basically, you go in a praying position. And you start with this finger. You just push. and hold, count to 10. It's up to you. I usually hold it longer, and it feels good with stretching and working my fingers so it can extend. Because I have a problem extending when it's flat like so. I can't really extend it that high. Sometimes I'm just starting to right now. So I just go like this. 1, 2, push. 3, 4, 5, 6, 7, 8, 9, and 10. And I push the other way to help with that strength development. And I do 10 count again. And I do this for each finger. 10 there, 10 here. And I go there, 10 here, 10 there, and then the little pinky. 10 here and 10 there. And I do that throughout the day. This works good on developing the thumb. I put my hands together, and at first I could barely lift my thumb. And maybe go right here. That's it. Now the range of motion now has improved. It can go up here, and basically the same thing with thumb. I go there and I push and do count of 10. I repeat for strength development. And I do the other thumb. Push the other thumb. That's a little bit harder. See, it's my right hand. Can't push that well. So, but you keep doing it repetitively until it gets stronger. Still an ongoing process in developing my right hand strength. According to my occupational therapist, who discharged me this week, and her dynamometer, at the beginning my hand strength was at 0 pounds per square inch. Now, when she assessed me again at the end, I can squeeze about 14 pounds per square inch. So there's improvements. Like I said, it's an ongoing process, an ongoing workout. But eventually my intention is to do more hand-related pressure exercises. So that'll be coming up in another video. I am so thankful to God that when I had this stroke, I could still walk. But I knew I needed to work on lower leg strength, coordination, and overall smoothness. And I'm getting there. It's a day-by-day battle. Thank you, Jesus. Thank you, Jesus. I can do all things through Jesus Christ who strengthens me. At the beginning stage of my walking recovery, I could walk maybe for a length of 2 to 3 minutes at a time because I tired easily. It was a lot harder to walk back then. Several weeks ago when I started this journey, just standing up and coordinating the legs to move, that was tough. That's difficult. It's still tough, but it's a work in progress. I'm up to 20 minutes at a time now when I walk. I had to slowly work up to it, build strength, endurance, and stamina, improving day by day, step by step. Here's the progression of my lower leg exercises. During the exercise, it's important to monitor your heart rate, your blood pressure, and you have to know when to stop or slow down. So it's important in preventing another incident because of that second chance stroke and other things. Got to watch your health now. So it's important again to have one of these, a pulse meter. Okay, important. Buy this Walmart. I bought this for back then maybe it was 30, 40 bucks. Now it's up to 50 bucks, but this is an awesome tool. Got to have it if you're monitoring yourself and your heart rate. Also the blood pressure kit. I had this for 15 years now, and when my heart rate monitor and my pulse meter oxygen says it's a little high and I need more details, I use the blood pressure. This is an invaluable tool to have. And that'll let me know where I'm at, what my blood pressure is doing. Sometimes it's got stress, sometimes it's just I didn't get enough sleep. Sometimes it's poop control. You're constipated, can't poop. High blood pressure comes up. I noticed that, but I've been, eating more fiber. I've been, for some reason, those muscles are working more better each day. So I'm, able to go every maybe 2 days. So that's a good thing. I'm out without Ducalex. Woo! That was a pain, but I had to use it. Now I don't need it. Hopefully, thank you, Jesus. I try to keep my workout under 70% of my maximum heart rate. Again, the heart monitor. That's about 120 beats per minute. That's a good workout zone for me right now. One day when I'm much better, I would like to work out at about 80% maximum heart rate. I'm getting there day by day with God's help. Perseverance, persistent, and lots of hard work. And overall time on task. As I said before, it takes a lot of time. Lots of time. Dedication and lots of sweat. Boy. At first, I had to learn how to use the cane. So I'm going to demonstrate what my therapist showed me on the proper use of the cane. I try not to use the cane as much, but I do when I'm tired, and if I'm outside, and if I'm even surfaces or raining weather. Use the cane. So I'm just going to walk here, then I'm going to talk on how to do it on the way back. So the cane helps with stability control and smoothness of coordination. So it's my right leg that's impacted. So what I do is you move your cane with the right leg. And then you step. Move the cane with the impacted leg. And step. Move the cane by right so. And step. And notice that's a little better control on the walking with the cane. But now I'm going to demonstrate how to walk without the cane. How my progress is doing without the use of the cane. I still wobble, but notice I lift to the right. I gait to the right. There's a pause. There is a pause to my walking, but I can walk. I do this for 20 minutes at a time when I'm not so tired. When I get tired, I hit the bike. It's a lot easier. So, but yeah, my walking is getting better. It's getting a faster movement, but I'm concentrating on quality of the movement. Quality movement. As I said before, when I first started, it was tough. 2 to 3 minutes, maybe 10, maybe 5 to 10 back and forth. And I'm tired. I'm so tired. And I gradually built this endurance and stamina. I just back and forth. And I used to walk this path. Now I added the kitchen along with it for longer distance and it changes surface area. I do walk outside in my backyard when the weather's not too hot, but I walk. But notice my arm. It's not natural, especially my right side. It just hangs there. I would like to walk holding my hands up higher like I usually do, but that's the difficult task. I can do for a couple of minutes and then it goes back down. So I do this. Sometimes I put my hands together when I'm tired, just for balance, just walk like this. But now I'm improving with distance and stamina. I can do maybe 20 minutes. I might hit 30 hopefully in a week or so. I'll try that, but I got to monitor my heart rate because my heart rate does go up because it does, it requires more work with weight bearing exercises and controlling balance. So that's what I do. Alright. Here are some other exercises that I do every other day. I'll alternate with a mix of lower legs and upper body exercises. I mix it up because you can't just do all lower legs. You're just going to be so tired and worn out. You have to alternate and then go with what your body feels. You have to go with what the body feels. If you're tired, then find something easy to do. Pronation exercise. I want to work on walking skills now when I'm tired. Prevention is key, especially falling. I have not failed at all one time during this journey, and that's my intention, not to fall. Because if you fall, it gets worse. It gets worse. I know from my parents' perspective. Alright, the first one I want to demonstrate is chair half squats. Good for the crunches up, good for straining the muscles. At first, when I started this, I had to use the lower part of my hands to help me stand up. I could do maybe 10 at a time, and then I control the movement sitting down. Control the movement sitting down. It's good practice for that toilet, because that toilet is hard when you hit it fast. So I use my hands standing up. That was at first. I did 5 or 10 of these, and sometimes you can use your thigh muscle to push up. Okay, if you're at the beginning stage and you need a little assistance, use a higher chair. You can work on a chair like this, but it's lower. It requires a lot more effort. So use a higher chair. Okay, half body squats. Okay, and I do this for a total of up to 50 at a time. Now you don't need the assistance of a push off or push down to control myself. Okay, control it. Okay, I do about 50 at a time, and it's a good workout. As I say, control the seated down position. You want to keep your body aligned and straight, you know, and focus. So it's good, a good workout. And 50 is good. If I try to do 100, I might be able to do 100, but I'm going to be sore. I do next exercise is knee raises in marching in place, or with or without the band. You can do this standing up. So basically, you might want to use the kitchen counter if it's higher up, so it's easier to control your body movement from falling. So can you see this? I see your arms. All right. So basically, you just knee raises, march in place. Take your time. Like I said, use a higher surface area, like the kitchen sink. I would use this chair, but it moves on me. It's not so stable. But depends on how much control you have. Up, down, and you can do the knee raises. Depending on you, but I do for about a count of 30. Count of 30. You can also do it seated down. Okay, can you get my knees? All right, and this is with or without band. You can do knee raises that way. 1, 2, it's easily I can do about 50 of these. 3 without the band. But that's how I started. Just doing this. And it sometimes hurts your lower back if you don't watch it. So be careful here with this exercise. Your lower back will start hurting. This is with the band. This is good for if you want more of that strength development. Okay, as I showed you this before, basically wrap around nice and tight. Fit band work. Something that's flexible. It's good to have. Maybe a $10 value. I think 5 and below. I bought this one, 5 and below. You tighten it up a little bit, and you just raise. Sometimes you want to raise and do the whole count, and that's good. This helped me train myself to put on my socks, because at first I couldn't lift my legs by yay high. Now I can lift them up and hold them for a while. Alright, so basically we're just doing this. Alright, the next exercise is the leg lateral standing up or laying down. Go back to standing position. Take this off. And basically you can do it again on a counter sink, kitchen sink area or something higher. This is for demonstration. You just take it out like this. And I do this for about 25 counts. Even laying down in the bed or on the mat. Okay, so basically controlling the movement. That chair's in the way, funny. Alright, so I'm going to demonstrate on the mat later so you can see the struggles I have with laying down and rotating and things like that. Calf raises, seated or standing. At first, go ahead and, okay, you can do this as I showed you this before. This is a great exercise. Helps with the walking skill and not dragging your feet. At first, when I started this journey, I was dragging my right side because I had a problem with holding these muscles up. So what I do is I just curl my toes up, which I couldn't do before in the beginning of this journey. Now I can curl them. And I just change back to the toe, back to heel, and this is easy to do. This is probably one of these exercises. I do about 100 of these, times up a calf muscle, but I do prefer to stand up. So I stand up and I just do calf raises standing up. That's also easy for me, but it helps with that weight bearing exercise. And I do about 30 of these. Hold it slowly. Okay, you want to hold it slowly, control it. Controlling is the key. And in holding it will develop that strength. So that's a good one. Next exercise, my favorite, most difficult still, is the hamstring curl standing or on my stomach or on the mat, which I'm going to demonstrate at the end. Okay. As you notice, very easy to do. My left side. My right, I can do it before I can barely move this thing up. I can get about yay high and that's it. But I can do about a good amount, 20, 30. Usually I do 20 of these at a time. When laying down position, I might do more, which I will demonstrate later. It's easier to do laying down. So if you're having a difficult time doing standing up and controlling yourself, balance and all, do it laying down. Another hard exercise that I like to do is heel to toe line walking. A difficult but is of high value exercise that targets strength, coordination, or will improve balance. This one's pretty hard. Requires lots of balance, control. It's an ongoing process. So I'm going to go ahead and demonstrate. Walking. Alright, here we go. So basically, I'll start off doing this heel to toe like I'm drunk, but I'm not. But it's hard, and you balance. All those muscles are firing right now. Just trying to keep myself up. Okay, it's a hard workout, but control is the key. Taking time is the key. So I go back and forth on how to do this. So I just, see, notice I'm wobbling. It's a difficult exercise, but great value. Great value. Feels so good after this when I do this, every other day. It works those calf muscles. That's real time, folks.
Oh, jeez.
Real time. So you might need assistance on this. Definitely don't do this in the kitchen. Hard floor, not a good thing. So that's that. That's the heel to toe exercise. Woo! That's even tough. Trying to talk and walk at the same time. Heel to toe. But I do this maybe 2 or 3 times each time. Then I gotta stop and take a break. I'm gonna demonstrate the bike. At first, when I did this video, I had a difficult time with just using this small bike. This was about 40, 50 bucks. I had this for a long time now. And, you know, I just do this bike for cardio. But at first when I had difficulty doing the bike, I couldn't keep the right feet out there. So, you know, if you're having trouble, it's good. I used to have straps that come with it. I don't know what I did with my straps. But I stopped using this a few weeks back because I couldn't keep my feet. And plus stability. I move a lot. Alright, so that's the bike. Alright, I prefer to use the stationary bike. That's a lot better with stability control. Alright, the next is going to demonstrate the mat work. Some mat work. Alright, let me transition. This one, as you can see, is a little bit difficult for me. I'll struggle. I prefer to work on the bed, but I got a mat. I'm probably going to do more exercise on mat as I develop more skills. So, you know, I can use my left hand to get down. And I'm going to, first thing I do in the morning is when I'm laying in bed, I lay flat on my back. And I do stretching. You know, I'll focus on my right leg. This will work, stretch the gluteus, the hamstring area. Feels real good. And I'll just put my feet down like so. And I hold and pull. And, you know, 40 count, 50 count, not so bad. Sometimes I'll stretch my legs. And I just do this. I just stretch it as straight as you can get it. I hold it. You can feel the stretch. Okay, do about, you know, I do about 30 of these, 40. Sometimes I'll just hold it here. And I switch off legs because it's important to get both legs strength trained. This is a lot easier for me on the left side. Do the same thing. Stretch maybe 30 times. And sometimes I just hold it right here, hold position. Just feel the stretch. Okay, that's that workout on the leg stretch right there. Next one I'll demonstrate is the lateral raises, laying down position. So in the bed it's a little bit difficult to turn. How's it looking?
Yeah, I got the entire thing.
So basically, lateral raises, and you want to work on the slowness and control. Yeah, I do about 30 of these, about 30, because after a while you'll feel your gluteus muscles tightened up. It becomes difficult when you get about up to 20. And again, I do the same for the other side. I roll slowly, because it's hard. But the difficult part is the hamstring curl. And I gotta roll. So it's a little bit hard to roll. And this is good for pressure exercises, setting me up for those push-up exercises eventually. Because I need to work on some pressure exercises with the hands. Right side, again, was difficult, but I can do it. Oh, that's my left. That is my right. Oh, getting confused. So I'll do about 20 of these each time. It gets easier as I go. And I can go about yay far, and that's it. The other leg is good, it's easy. And then I do assistance with this leg. And I do two leg curl. And I just hold. Stretch that leg muscle. And I just do like this. Especially when I'm tired. I just keep going. Okay, so I try to do 100 of those in the morning. And maybe that's about it. Because it does work those hamstring muscles. Whew. Alright. I think that's all for now for the mat workout demonstration. So you notice it's hard to get up. Alright. That works on the hip abductors, include the gluteus medius and the minimus, contributing to improved posture strength and stability. I continue to work on walking, bike size, to improve my endurance, strength, coordination, overall mobility, and capabilities. My next focus is to work on walking backwards and sideways. That's the next level. My long-term goal, maybe in a few months or so, would be start working on jumping skills and transfer of body weight from a height, but that is still a distance away. For my next video, I'm going to demonstrate some exercises that I'm doing that will help with developing help develop my speech and swallowing skills. So some speech therapy exercise stuff that my therapist showed me. So if you're experiencing recovery from a stroke or heart-related battle, I'd like to hear your journey. Comment below on the link with your tips and strategies, because you could help someone else. It doesn't matter if you are on a stroke journey or a health-related journey, cardiovascular journey, or just trying to maintain health. Please comment with your strategies and tips. And hope we are in this together, and hope to ease the process for someone else going through this. Well, that's all, folks. My family and I want to thank each one of you for your help and continued support. Glory, honor, and praises to God. God bless you. Thank you for watching, and see you back later again. Thank you so much.